This oral liquid expectorant is used to relieve coughs caused by the common cold, bronchitis, and other breathing illnesses. Guaifenesin thins and loosens mucus in the airways, clearing congestion, and making breathing easier, while dextromethorphan acts on the brain to reduce the urge to cough. If you are using this medication, it is important to read the package instructions carefully to be sure it is right for you. Cough and cold products have not been shown to be safe or effective in children younger than 6 years, and some are not recommended for use in children younger than 12 years. These products do not cure or shorten the length of the common cold and may cause serious side effects. To decrease the risk for serious side effects, carefully follow all dosage directions and do not use this product to make a child sleepy. Ask the doctor or pharmacist about other ways to relieve cough and cold symptoms. When taking Robafen DM Peak Cold 10 mg, 100 mg/5 ml oral liquid expectorants, it's important to follow the directions provided by your doctor or on the product package. If you have any questions, be sure to ask your doctor or pharmacist. It's also important to stay hydrated while taking this medication, as fluids can help to break up mucus and clear congestion. The dosage of this medication will depend on your age, medical condition, and response to treatment. It's important not to increase your dose or take this drug more often than directed. If you are using the liquid form of this medication, be sure to carefully measure the dose using a special measuring device/spoon. For powder packets, empty the entire contents onto the tongue and swallow. And if you are taking the capsule form, swallow the capsule whole. It's crucial to use this medication properly and not to misuse it, as improper use may result in serious harm. Do not increase your dose, take it more often, or use it for a longer time than directed. If your cough returns, or if it is accompanied by a persistent headache, fever, severe sore throat, rash, or if it lasts or gets worse after 7 days, it's important to inform your doctor. These may be signs of a serious medical problem, and you should seek medical help right away if you think you may have a serious medical problem. Some common side effects of Robafen DM Peak Cold 10 mg, 100 mg/5 ml oral liquid expectorants include dizziness, drowsiness, nausea, and vomiting. If any of these effects persist or worsen, it's important to notify your doctor or pharmacist right away. If your doctor has prescribed this medication for you, they have determined that the benefits outweigh the risk of potential side effects. Most people using this medication do not experience serious side effects. While rare, a very serious allergic reaction to this drug may occur. Seek medical help immediately if you notice any symptoms of a serious allergic reaction, such as rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing. It's important to note that this is not a complete list of possible side effects. If you experience any other effects not listed above, it's advised to contact your doctor or pharmacist. If you are in the US, you can call your doctor for medical advice about side effects, or report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can call your doctor for medical advice about side effects, or report side effects to Health Canada at 1-866-234-2345. Before taking Robafen DM Peak Cold 10 mg, 100 mg/5 ml oral liquid expectorants, make sure to inform your doctor or pharmacist if you are allergic to guaifenesin or dextromethorphan, or if you have any other allergies. This medication may contain inactive ingredients that could cause allergic reactions, so it's important to discuss this with your pharmacist. Also, be sure to let your doctor or pharmacist know about your medical history, especially if you have breathing problems, cough with blood or large amounts of mucus, or liver problems. Keep in mind that this medication may cause dizziness or drowsiness. Avoid consuming alcohol or marijuana, as they can increase these effects. It's important to refrain from driving or using machinery until you can do so safely. If you are using marijuana, be sure to talk to your doctor. If you have diabetes, liver disease, or any other condition that requires you to limit or avoid sugar and/or alcohol, use caution when taking the liquid forms of this medication. Additionally, if you have phenylketonuria, PKU, or any other condition that requires you to restrict your intake of aspartame, consult your doctor before using the liquid forms or powder packets. Before undergoing surgery, be sure to inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant, use this medication only if clearly needed and discuss the risks and benefits with your doctor. Consult your doctor before using this medication if you are breastfeeding, as it is unknown if Guaifenesin or dextromethorphan passes into breast milk. When taking Robafen DM Peak Cold 10 mg, 100 mg/5 ml oral liquid expectorants, it's important to be aware of potential drug interactions that could affect how your medications work or increase the risk of serious side effects. Make sure to keep a list of all the products you use and share it with your doctor and pharmacist. It's crucial not to start, stop, or change the dosage of any medicines without your doctor's approval. Avoid taking certain MAO inhibitors, such as isocarboxazid, metaxalone, methylene blue, and others, while using this medication, as it may cause a serious and possibly fatal drug interaction. Your doctor can provide guidance on when to start or stop taking this medication in relation to MAO inhibitors. Additionally, be cautious of taking other medications that contain guaifenesin or dextromethorphan, as these ingredients are also found in prescription and non-prescription products. It's important to check the labels of all your medications to avoid taking more than one product containing these ingredients. Keep in mind that guaifenesin may interfere with certain lab tests, potentially causing false results. Make sure to inform lab personnel and your doctors that you are using this drug. If you or someone else has taken too much Robafen DM Peak Cold 10 mg, 100 mg/5 ml oral liquid expectorants and are experiencing severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call the local poison control center at 1-800-222-1222, or in Canada, reach out to a provincial poison control center. Symptoms of an overdose may include extreme drowsiness, blurred vision, confusion, hallucinations, slow or shallow breathing, and seizures. If your doctor has prescribed Robafen DM Peak Cold 10 mg, 100 mg/5 ml oral liquid expectorants, it is important not to share this medication with others. It is also important to keep all medical and lab appointments. If you forget to take a dose, take it as soon as you remember. If it's close to the time for your next dose, just skip the missed one. Take your next dose at the usual time. Don't take double the dose to make up for the one you missed. When storing Robafen DM Peak Cold 10 mg, 100 mg/5 ml oral liquid expectorants, it is important to keep it at room temperature and away from light and moisture. Be sure not to store it in the bathroom and avoid freezing the liquid form. Different brands may have different storage needs, so it's best to check the product package for specific instructions or ask your pharmacist for advice. Always keep medications out of reach of children and pets. When it comes to discarding this product, do not flush it down the toilet or pour it into a drain unless specifically instructed to do so. Instead, properly dispose of it when it is expired or no longer needed. You can consult your pharmacist or local waste disposal company for guidance on the proper disposal method. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.